Well, it's that time of year again when the cold hits, and so do the runny noses. With our immune systems threatened, many head to the clinic to get immunized.
The influenza vaccine is the single most effective way to protect oneself from influenza infection and disease. When we look at our population, you're not only protecting yourself, you're protecting those that you love and around you. When you're sick, stay at home and wash your hands.
There you go. Sick, stay at home. Remember that one.
The influenza vaccine, most people actually don't feel any kind of adverse effect. There is the possibility of some redness and swelling where you got the injection and maybe some achiness 24 to 48 hours after you get the influenza vaccine.
And with newer technology, means more advanced ways to be immunized.
It's called the flu mist, and it's a live vaccine that's given nasally. So it has a lot of benefits, especially for children between 2 and 17 years of age. So a lot of the younger kids that are coming in, they're a little bit more receptive to the flu mist. Other kids, it doesn't matter what you do, they're just unhappy with receiving any kind of vaccination.
Have you noticed that many children have been going for that instead? Or even, I'm sorry, but I think I would choose that personally. I'm not between the ages of 2 and 17, but for someone like me who doesn't like needles, could I guess, opt for that one?
Oh yes, yeah. Just recently, Alberta Health Services has increased our age group from 2 to 59. So that is something that a lot of our clients have been opting for. Within the syringe itself, there is a little bit of a breaker in there, so you give half of the dose into one nostril, take the little tab off, and give the other half of the dose into the other nostril.
And it's the exact same as if you're getting the needle, right? All the same benefits?
Exactly, yes. But the difference being with populations between 2 and 17, some studies have shown that there's actually a better immune response. So I guess, they're better covered, I guess you could sort of say. The flu mist, sometimes you might notice that your nose is a little bit runny, might have a little bit of a sore throat. So those are the differences between getting the injection and getting the flu mist. Like, there are limitations to when we can give the mist. So some limitations are if you're pregnant, if you have allergies to eggs, if you have severe asthma and things like that, because it is a live vaccine. So I guess after the age of 59, there are sometimes more respiratory issues and things of that nature. So that's why they've sort of limited to 2 and 59.
There's many choices whether or not to get the flu shot, and if your excuse is that you don't like needles, well, think again. For more information to find out where you can get your flu shot, go to www.albertahealthservices.ca. With Shaw TV, I'm Jordan Hertner.